Blood sugar monitoring is when someone uses a glucose meter, which is a machine, to check their blood sugar. The blood sample is usually taken from the finger. There are some machines that allow us to use different sites on the hand or on the arm to get the blood. And not everybody with type 2 diabetes has to check their blood sugar.
So a patient on insulin should be monitoring their blood sugar, or if they're taking other medicines that increase the risk of hypoglycemia. Also, if you feel unwell, it's important to check your blood sugar to make sure you're not feeling unwell related to a low or high blood sugar.
And if they have a tendency to feel symptoms of low blood sugar, we like to have them check their blood sugar just to make sure we're avoiding those situations. If someone has uncontrolled diabetes and we're not exactly sure why they're not able to get under control, I might have them check their blood sugar at least temporarily so that we get some more information.
I also ask patients sometimes to check their sugars just to be able to identify the foods that are not so good for them. When they are not sure, they feel that they are eating very well, they are doing their best, but the sugars are still high. Then I ask them, okay, keep a food diary and start checking your sugars a little bit more often, sometimes before meals, after meals, just to help us identify those foods that are more damaging to the condition.
So when we have people who are checking their blood sugar levels and they have type 2 diabetes, we usually give them a target range depending on what time of day it is. If they check their blood sugar first thing in the morning, which is fasting before they've eaten anything, we like to see their blood sugars anywhere between 70 to 80 on the low end and about 130 on the high end. For when they check their blood sugar 1 or 2 hours after eating, ideally that number would be below 160, most certainly below 180.
Some people think it's a little painful because you have to be using a needle, or if you're scared of needles, it might be a little bit more nerve-wracking, but you can get used to it. And as a matter of fact, a diabetes educator will help you do it and coach you through the process so that it's less painful and less frightening. When patients are well controlled, meaning the A1C is below 7, we don't need to be checking the sugars that often, maybe only when you're feeling sick, something like that. But if not, you need to be keeping an eye on your sugars. I tell them all the time, it's like, do you check the weather report before you get out of the house? And everyone's like, yeah. And I'm like, why do you do it? And it's like, well, it's because I need to know how to dress. And I'm like, well, if you check your sugars every morning, you're gonna know what you need to eat. And that's vital, So I make that comparison, and then people start getting the importance of monitoring.